What surgical options treat hearing loss? Imagine a world where hearing loss can sometimes be improved through surgery. While not every type of hearing loss can be fixed this way, several procedures have proven effective for specific conditions. Let's explore some of the main surgical options available today. One common procedure is the stapedectomy, which is used to treat otosclerosis. Otosclerosis is a condition where abnormal bone growth around the stapes bone in the middle ear prevents it from vibrating properly. This leads to conductive hearing loss. During a stapedectomy, the surgeon removes the affected stapes bone and replaces it with a tiny prosthetic device. This helps restore sound transmission. The surgery usually takes about an hour and is often done on an outpatient basis. Hearing improvement can be noticed over the following weeks as swelling decreases. Another option is ossicular chain reconstruction. This surgery is similar but involves repairing or replacing multiple middle ear bones, called ossicles, which include the malleus, incus, and stapes. When these bones are damaged or malformed, they can block sound from reaching the inner ear. Surgeons use prosthetic implants to rebuild the chain and improve hearing. This procedure is tailored to the individual's specific damage and can significantly enhance sound transmission. Tympanoplasty is a surgical repair of the eardrum, which is also called the tympanic membrane. If the eardrum has a perforation or tear, it can cause hearing loss. During tympanoplasty, a surgeon uses tissue grafts, often taken from the patient's own body, to close the hole or repair damage. Restoring the integrity of the eardrum helps improve hearing and prevents infections. For those with fluid buildup or chronic middle ear infections, myringotomy with tube placement is often recommended. The surgeon makes a small incision in the eardrum to drain fluid and inserts tiny ventilation tubes. These tubes help keep the middle ear aerated and prevent fluid from accumulating again. This procedure can improve hearing affected by middle ear effusion and reduce the risk of recurrent infections. In cases where infections have caused damage or disease in the mastoid bone behind the ear, a mastodectomy might be performed. This surgery removes infected air cells in the mastoid to prevent further damage and help preserve hearing. It is particularly useful when infections threaten the middle ear or inner ear structures. For individuals with severe to profound sensorineural hearing loss, cochlear implant surgery offers a remarkable solution. When inner ear hair cells are damaged beyond repair, cochlear implants can bypass these cells entirely. The device consists of an external processor worn behind the ear and an internal receiver implanted in the cochlea. The implant directly stimulates the auditory nerve, allowing the brain to interpret sound signals. The surgery usually takes several hours and requires careful programming and rehabilitation afterward. Some people are born with congenital ear deformities or malformations that affect hearing. Congenital ear reconstruction can help restore the ear's shape and function. This may involve reconstructing the outer ear, ear canal, or middle ear structures, depending on the individual's needs. These surgeries are complex and often involve multiple stages, but they can significantly improve hearing and appearance. Finally, when benign tumors such as acoustic neuromas develop on the auditory nerve, surgical removal may be necessary. The approach depends on the tumor size and the patient's hearing status. Some surgeries, like the retrosigmoid or middle fossa approaches, aim to remove the tumor while preserving as much hearing as possible. Others may sacrifice hearing if the tumor is large or if preservation isn't feasible. These procedures are performed by specialized surgeons and requiring careful planning. Each of these surgical options targets specific causes of hearing loss, whether conductive, sensorineural, or mixed. The best choice depends on a thorough evaluation by an ear, nose, and throat specialist or audiologist. They will consider your overall health, hearing level, and personal circumstances. It's important to remember that surgery is often part of a broader treatment plan that may include hearing aids or auditory therapy. Always consult with healthcare professionals to determine the safest and most effective approach for your individual needs.